This animation will demonstrate the presurgical restorative steps and surgical placement of a tapered screw vent implant, where an immediate provisional restoration is used. A preoperative model was created, and an analog was positioned into the desired location of the implant. An abutment is chosen, and preparations are initiated prior to surgery. Preoperative abutment preparations will help reduce the modifications required on the day of surgery. The treatment planning process contributes the most to the success of this technique. Patient selection and preoperative preparations are all essential components that yield the benefits of the SmartSteps immediate provisional restoration technique. Patient acceptance of implant dentistry may be hindered by the time that elapses from implant placement to restoration. SmartSteps immediate provisional restoration technique, demonstrated here, provides the patient with an aesthetic result on the day of surgery. A mesiodistal incision with vertical release is used to expose the alveolar crest. A periostal elevator exposes the implant site. The required surgical tools are sterilized prior to the patient's arrival. A surgical stent was created during the preoperative planning of the case. A round burr is used to mark the desired location of the osteotomy. External irrigation is used throughout the entire procedure. A 2.3 mm pilot drill is used to excavate the site to its full depth. Drilling at speeds of 600 to 850 revolutions per minute is recommended. Use of a parallel pin is an important step after the pilot hole is drilled. It is after the pilot drill is used when variances in angulation can be corrected. Upon verification of the proper angulation, the 2.8 mm intermediate drill is used to increase the diameter of the osteotomy. This graduated drilling sequence is required in all implant cases as a means of limiting the amount of heat generated during drilling, while also providing steps to check the accuracy of the osteotomy during excavation. The larger side of the parallel pin is used after the intermediate drill to verify the relative position of the implant site. The tapered screw vent implant features surgical protocols for both soft and dense bone. The dense bone protocol, featuring a stepped final drill, is shown here. Every tapered screw vent implant comes with a fixture mount that also functions as a transfer and a preparable temporary abutment. The tapered design allows the apical portion to guide the implant into the osteotomy before self-tapping initiates. The tapered screw vent implant features triple lead threads, which allows the implant to seat with 1/3 of the revolutions required to seat an implant with a typical thread pattern. The flat of the fixture mount, which corresponds to the flat of the internal hexagon, is aligned according to the presurgical model used to prepare the abutment. The prepared abutment and temporary crown that were fabricated prior to surgery are delivered to the implant. The abutment is finger tightened on the implant at the time of surgery. The screw channel is blocked out using traditional techniques, and the temporary crown is cemented into place. The surgical specialist ensures no occlusal contacts are present and that the surgical site is thoroughly cleaned of cement. Using an aesthetic restoration at the time of surgery allows the gingival contours to be sculpted from the time of implant placement. Performing this technique will allow the maturation of the soft tissue to closely follow the anatomical contours of natural dentition. The SmartSteps provisional restoration technique will provide the patient with an aesthetic result on the day of implant placement, paving the way to practice growth through increased patient acceptance and satisfaction.